Good afternoon. Today we'll be talking about Polycystic Ovarian Syndrome, which is a very common problem faced by especially adolescents in this century. It's basically a lifestyle disorder, and most of our young girls are affected by this disorder. It affects, say, maybe about 50 to 20% of the young women, the adolescent girls, and the main crux of the problem is lack of physical activity. What actually happens in polycystic ovarian syndrome? These patients come to us with a complaint of weight gain, excessive hair growth around the face, on the chest, on the legs, irregular periods, missing of periods, and lethargy. It is basically a hormonal imbalance caused by multifarious factors. The first factor is lack of physical activity, which results in weight gain, wrong diet principle, excess of junk food. Number 3, there may be a disorder of the thyroid, there may be a disorder of the prolactin, there may be decreased levels of vitamin D, all of which contribute to the development of polycystic ovarian syndrome. Now, why is it called a syndrome? It's called a syndrome because there are a gamut of problems. Number 1, there is irregular periods. Why? Due to irregular ovulation, or rather what do we say in medical terminology, oligoovulation. Number 2, there is irregular bleeding. The bleeding may be sometimes prolonged. There is excessive weight gain, there is obesity, there is excessive hair growth on the body, which is called in medically as hirsutism. And these patients in future have a problem of conceiving. Why? In polycystic ovarian syndrome, the patients lack ovulation. They do not ovulate. They do not produce their eggs. And you don't, as you all know, if you don't produce your eggs, you cannot become a mother. You cannot bear a baby. So these are the patients who are prone to infertility. These are the patients who are in their mid-age have a 30% chance of developing diabetes. These are the patients who in their mid-age have got a higher chance of developing hypertension, and further down the line they have a higher risk of developing endometrial carcinoma. That's why it's called a polycystic ovarian syndrome, a syndrome which causes a gamut of problems. It is a metabolic disease also. But the treatment is very, very simple. Control your diet or modify your diet, cut down on your carbohydrates, cut down on your fat, increase your protein diet, do exercises, a minimal exercise schedule of maybe half an hour of brisk walking every day, any time of the day. You need not get up early in the morning for a walk. You can walk whenever you've got time. We find these young girls complaining very often, "Mera paas time nahi hai." This is not done. You've got to find time for yourself. Everyone studies, everyone is into their daily curriculum. So you've got to bring out time for yourself so that you stay healthy. So regular exercises, a strict diet, and get tested for thyroid, get tested for prolactin, get tested for vitamin D. If any of these have got a problem, treat the specific problem. Even if you do exercises and diet, your periods are not regular, then maybe the medication starts. Medications which are given are somewhere helpful in reducing the weight of the patient. If you are a married woman not able to conceive, then also number 1 is you need to cut down on your weight. You need to see your doctor so that he can give you medicines which will produce the eggs and document it in a serial sonography, which is called folliculometry, and they tell you that this is the time that you're producing your eggs and you can try for your pregnancy. Number 3 is you should be very vigilant about diabetes when you develop diabetes in the mid-30s. When you get pregnant, even then you should be very careful because you stand a higher chance of developing gestational diabetes mellitus, which is called diabetes due to pregnancy. So to sum up, it is not something that I want to instill a fear in you. It is something that I want to educate you about. I want to make you conscious about this is a disease which can be cured by simple means: a good diet, a good lifestyle, a bit of exercises, and medicines if necessary. So all your young girls, buck up, tie up your shoes, and get back to exercise and avoid the junk food. That's it. Thank you.